Okay, hi, I'm Dave Stanton. I have an order to give heparin, 5,000 units subcutaneously every 12 hours for 3 days to patient Skip Rocker, born 1/1/1972. It's a 42-year-old male by Dr. I. M. Jumpy. So I need to make sure I give this medication to the right patient, Skip Rocker, the right medication, heparin, the right dose, 5,000 units, the right route, subcutaneously, the right time, every 12 hours for 3 days, beginning now. I'm within half an hour of my order, and use the right documentation. I have the order, I have my MAR, and I will document in the patient's chart when I give this medication. So I've checked the MAR. Now I'm going to check my medication. I have heparin. It's 10,000 units a milliliter, and there are 2 milliliters here. The expiration date's fine. The medication doesn't appear to be tampered with or cloudy in any way. Everything looks great. Expiration date's good, not tampered with. Heparin, 10,000 units, milliliter, 2 milliliters. So I've done my calculations. I'll be giving 1 milliliter. I'm going to check this against the MAR. Heparin, 5,000 units. Yep. So that looks good. So my patient doesn't have any allergies for this, and there's nothing that would preclude this in his chart. So right now, what I'm going to do is prepare this medication. So I'll do some hand hygiene. I've got my 2 checks. I can do my 3rd check at the bedside. I'm going to take an antimicrobial swab, and I'm going to go over my vial, and then I'll use the package to open it. So I'm going to have to, for equipment reasons, I'm going to use a filter here and a needle. I don't have the proper needle, but I would be using a small needle, a tuberculin needle with a 27 gauge needle. But because the one that I have, I can't change. I just have to make do with what I got. So I've got my syringe. I'll make sure that my surface is clean. Then I'm going to set this, and I'm not touching anything but the barrel. I'll remove my filter now, and doing the same thing. Okay, I'm going to attach that filter to my syringe. Great. Now I will need to open this away from me. Grasping this, and okay, there was no medication in the top. I had made sure of that. So now I will withdraw 1 milliliter out of my ampule into my filter. Making sure that I have no air bubbles. Pushing those back. A little bit of a mess, but that's all right. Okay. So I have that into my filter. I will set that down for now. I will take my medication and my container to the bedside. There I will identify Mr. Rocker by his name and birth date using his armband. Skip Rocker, 1/1/1972. Ask him about allergies. Celebrex, this would be a great time for my 3rd check. I have heparin. I have withdrawn 1 milliliter. It was 10,000 units per milliliter. There were 2 milliliters. My order's for 5,000 units. I have 5,000 units. My expiration date is good. I've withdrawn it into a filter needle. I can now prepare for the subcutaneous injection. I would be using probably the skin on the back of his arm, because I have to give this patient a insulin injection, and I was thinking I would probably use the abdomen for that. So rotating sites, that's what I'm going to do. So I would do some hand hygiene again. I would glove up. Actually, this says to give it on the abdomen. The sub-Q would be appropriate in the back of the arm, but for purposes of the abdomen, I would go away from the umbilical, making sure that I'm far enough away from that, over into the subcutaneous tissue on the sides of the abdomen. I'll just pick one side. I'll do the insulin on the other side, so I would just pick the right side, making sure that I'm an inch over. I would have the patient properly positioned so that I could do that. Explain to the patient what I'm going to do. Okay, so now I would take the alcohol swab, begin in the center of the where I'm going to give the administer this to the patient. Get that clean. Now I've touched the patient. I'm going to switch, so I would change my gloves, hand hygiene, put on new gloves. Now I'm going to switch to the needle, and the reason I'm having to do this is because of an equipment problem here, appropriate for the demonstration. Okay, double OK method. Withdraw that. This needle is, again, not the appropriate needle for a sub-Q, but I would use the proper needle if I were able to. So to administer this, I would pinch the skin so that I could get make sure that I get into that subcutaneous tissue without getting into the muscle. I would go at a 90-degree angle, not aspirating, and I would inject the medication slowly and withdraw, and I will one-hand scoop for safety, grasping low. This goes into sharps. I would take a gauze or bandage over the patient's area if I need, not pressing, but if I needed to clean it. I would dispose of my trash appropriately in sharps or the waste bin. I would do some hand hygiene. Take my gloves up. Get rid of that. Hand hygiene. And I'm going to document that I administered heparin in the MAR. And I'm going to include the site and the dose of 5,000 units subcutaneous, and this time, so that this can be given to the patient appropriately. Thank you.